Well, first of all, I also want to say thank you so much to the ASA for inviting me to speak. What I want to talk about for a few minutes is, I think, the elephant in the room, and that is the question about whether medical marijuana is something of the past now that states are moving toward full legalization of marijuana for recreational use. It was a question that was raised in late 2011, early 2012, as momentum grew for the efforts to legalize marijuana in Colorado and Washington State, and to a lesser extent in Oregon, by the executive director of the National Organization for Marijuana Legalization, Alan St. Pierre, who was quoted online arguing that, quote, defending the so-called medical marijuana industry is so yesterday. St. Pierre called the industry, though not medical cannabis itself, quote unquote, largely a sham, because he argued most patients, in quotes, are in fact recreational users, and most caregiver organizations are profit-making enterprises providing little more than marijuana at market prices. And St. Pierre concluded that the movement should, quote, acknowledge the political and legal farce that medical marijuana has become and focus on the real problem at hand, ending cannabis prohibition, unquote. Well, not surprisingly, his comments were denounced by many of us in the medical marijuana movement as not only an insult to patients and providers, but also as an ill-advised strategic and political blunder. But the question remains, was St. Pierre correct? Is medical marijuana a thing of the past? Should efforts within marijuana policy reform focus on broad legalization instead, especially in the wake of the recent successes of the ballot in this area? Now, you have to understand that my approach to this question is heavily shaped by my own history in the medical marijuana movement. As a researcher, I had the amazing good fortune of being in the right place at the right time to study the beginning of state-level legalized medical marijuana. I lived in Santa Cruz, California in the 1980s and 1990s, and I witnessed and recorded the origins of the country's first patient caregiver collective, the Women's Alliance for Medical Marijuana, started by Valerie and Michael Corral. WHAM was composed of about 250 patients, most of whom were living with and dying of life-threatening illnesses. The group grew the cannabis collectively on land owned by Valerie and Michael Corral. The marijuana was harvested and transformed by the membership into an array of medicines, including tinctures, edibles, capsules, milks, and dried herb for smoking or vaporizing. And the marijuana wasn't sold. Instead, it was distributed free of charge to the membership. The group also provided informal hospice support for the many members who died over the years that I studied the organization. It was an amazing social experiment in grassroots healthcare provision and support. And it posed a serious enough threat to federal cannabis prohibition that in 2002, the DEA staged a raid on the collective's garden and arrested the two co-founders. WHAM prevailed, however, sued the DEA in federal court and won. Yes, one of our great victories. Because WHAM operated outside of a cash economy, the group truly made marijuana available to all of their members, regardless of ability to pay. And because the organization focused on the sickest of the sick, with 85% of the membership living with a life-threatening illness, the group provided a tremendous amount of care. Now, this radical vision of marijuana as medicine, the one I wrote about in my 2007 book, Dying to Get High, has largely been supplanted in the public view by the subsequent rise of large buyers clubs or dispensaries with thousands, and in some cases tens of thousands of members. The dispensaries, while ostensibly nonprofit, do make millions of dollars a year through the sale of marijuana to those with physician recommendations in the states that have medical marijuana laws. That model of cannabis prohibition through a dispensary system has spread from California to states like Maine, where I live, and Colorado, and elsewhere. WHAM, meanwhile, still struggles along, still with only a few hundred members, still collectively growing their own cannabis, still dependent on donations, and still barely able to pay the rent and a few low-level salaries every year. But in the mind of many Americans, medical marijuana now appears to be less about health care provision and more about legal access to marijuana. The dispensary system is seen by many as a sort of test run for what legalized marijuana distribution might look like if cannabis was no longer a prohibited substance. In fact, this was an argument used in Colorado during the legalization campaign by reformers who pointed to the relative success of medical marijuana dispensaries as a form of cannabis regulation, keeping it out of the hands of underage people, for instance. In the state of Colorado last year, there were close to 90,000 residents with state-authorized medical marijuana cards. And it's precisely that explosion of medical marijuana dispensaries and the large cultivation operations necessary to provide them with the marijuana to sell that Alan St. Pierre was referring to when he spoke of the medical marijuana industry that he sees as largely a sham because it disproportionately serves young men in their 20s and 30s with the need for cannabis to manage pain as opposed to serious or life-threatening illness. From St. Pierre's perspective, this is compelling evidence that the future of marijuana reform is full legalization, not the continued expansion of medical access. And success at the ballot box seems in some ways to confirm his assessment. But not all medical marijuana activists are convinced. Some in Colorado, for instance, argued that legalization might serve as the equivalent of a red flag waved in the face of Federal Drug Enforcement Administration. While the Obama administration has fortunately not taken any action yet against Colorado or Washington to undermine their new laws, the concern seems to me not entirely unreasonable. In 2011, just as California was poised to vote on Proposition 19 that would have legalized marijuana in that state, U.S. Attorney General Eric Holder announced that he would, quote, vigorously enforce, unquote, federal drug laws in California if the measure passed. In addition, past practice by the Obama administration on medical marijuana reform is not entirely reassuring. In 2009, shortly after the Obama administration took office, the Justice Department issued the so-called Ogden Memo, which declared that the sale and use of medical marijuana in states where it's legal would be a low priority for federal prosecutors. But despite that memo, federal drug raids during the first term of the Obama administration of medical marijuana dispensaries surpassed the record high set by George W. Bush. In Colorado, for example, 40 dispensaries operating in full compliance with state and local law were closed in 2012 alone, and California has experienced a record number of raids on state-licensed dispensaries, including some of the best-run and earliest founded dispensaries, like the Berkeley Patients Group, actually high. In a recent interview I did with the co-founder of WHAM, Michael Corral, he noted, quote, except for the patient collectives currently operating outside of a business model like WHAM, what you've created in medical marijuana states are monopolies, and that keeps prices high. It's a limited commodity. In 2002, though, I did a basic cost analysis for Lester Grinspoon, who was working on a book about medical marijuana. I calculated that if you were farming marijuana on enough acres, even with the expense of a sophisticated security system, and even if you were paying workers reasonably well, I think I estimated $12 an hour and included health benefits for everyone, the cost of cannabis would come out to $30 an ounce. I really tried to inflate the cost of production, but when I got done, I couldn't believe how cheap it would be. That's one of the reasons the big growers supplying the medical marijuana market tend to oppose legalization, he said, unquote. So some medical marijuana growers can't really afford to see medical marijuana become so yesterday. The competition from the legal recreational market might be an issue. On the other hand, I think there are other factors beyond state-to-state legalization that could make medical marijuana as we know it a thing of the past. And first and foremost among these is the pharmaceuticalization of cannabis and cannabinoid medicine. As Michael Corral of WHAM told me, quote, the medical issue is a done deal. We've won that war. But it's not clear yet what the terms of surrender will be. There's no stopping medical marijuana nationally or internationally. The genie can't be put back in the bottle. But what form will it take in the future? Will patients be allowed to grow, or will the pharmaceutical companies take over all of it? That's what I mean by the terms of surrender. And as always, the devils are in the detail. As we heard earlier today, there are a number of all of the pharmaceutical companies are interested in cannabinoid medicines, and at least one of them, GW Pharmaceuticals, has a product, Sativex, that's in phase 3 trials right now in this country. It's a whole plant extract, and it's not a synthetic, and it's poised to be the first one in the market in the US with FDA approval as a botanical cannabinoid medication. And it's going to be an issue in terms of competition with the dispensaries. Michael Corral argues, quote, "This is why the US attorney on the West Coast are going after the big dispensaries. They're going after Harborside right now, for example, which has a little over 100,000 members. Now imagine a Harborside in every state. Then you're taking millions of people, and you're talking millions of people, and that's a big chunk of the pharmaceutical market. If you let that proliferate, that's going to cut hugely into the bottom line for big pharma," unquote. And it's certainly true that, as I said, the pharmaceutical industry is paying attention to cannabis. One of my favorite pieces of evidence of that is watching the financial pages of newspapers. In 2011, for instance, MSN Money ran an article called "Could Legal Pot Give Big Pharma a Much-Needed High?" And it pointed out that already medical marijuana sales in the US are estimated at about $2 billion a year in the 17 states where it was then legal. And MSN Money notes, quote, "If the US government ever legalizes marijuana, sales would probably make the $11 billion Pfizer raked in on Lipitor worldwide last year look like chump change." As you heard again earlier today, all the pharmaceutical industries are exploring cannabinoid medicines, and there have been a number of large international conferences sponsored by corporations like Bristol Myers Squibb, GW Pharmaceuticals, Eli Lilly, Merck, and Pfizer. And drug manufacturers are already involved in the development of several cannabinoid medicines. In addition to the synthetic THC drugs Marinol and Kesomet, there are nearly 24 other new cannabis-based or inspired pharmaceutical compounds undergoing safety trials. Sativex is, as I said, the first of these, and it's available now on prescription in several European countries, the UK, Spain, Germany, and Denmark. I think those are the ones that's currently available. It's available also on prescription in New Zealand and Canada. And in the US, it is undergoing trials for treatment of cancer pain. What I think is really interesting about Sativex, among other things, is that it's making the pharmaceutical company, GW Pharmaceuticals, is making use of former US government insiders to help push the drug through to approval, including US Deputy Drug Czar, former US Deputy Drug Czar Andrea Barthwell, who became a paid lobbyist for GW Pharmaceuticals after she left the Bush administration. And she was very forthright in her explanation of how she could move from a position absolutely opposing the medical use of marijuana and arguing that marijuana as a botanical had absolutely no medical value, to a position of supporting approval for a botanical cannabis tincture manufactured by a pharmaceutical company. One of the great advantages of Sativex, Barthwell explained, was that it would be under federal control and, quote, would slow down the dash to make the crude plant material available to patients, unquote. Drug warriors thus see pharmaceutical drugs like Sativex as a tool to ensure that medical marijuana as we know it is so yesterday. Legitimate patients could be sent to pharmacies for medications rather than dispensaries or home gardens. Big Pharma could also, or Big Pharma does also benefit from the continued criminalization of medical marijuana as it currently exists. In fact, I would argue that the continued criminalization of cannabis is absolutely essential to the pharmaceuticalization of cannabinoid medicines. This gets back to Michael Corral's cost analysis of what Barthwell calls crude plant material. Botanical cannabis is relatively inexpensive to grow, and it isn't especially expensive or difficult to make cannabis tincture, for instance, comparable to the Sativex spray. WHAM members, for example, produce it on their own and give it away to the membership either free or at cost, which is about $10 or $20 a bottle. Dispensaries also provide tincture at a reasonable price for patients. In Canada, Sativex is available on prescription at about $125 for enough extract for 10 days. So Big Pharma relies on federal drug prohibition to make cannabinoid medications competitive. Now, I don't want to get all conspiracy-minded here, but it might be useful to note that the pharmaceutical lobby is the biggest lobby in the United States, providing millions of dollars in donations to candidates from both parties. In fact, from 1998 to 2010, Big Pharma spent more than $2 billion on lobbying. That's more than $500 million more than its closest competitor, the insurance industry, and almost twice as much as what the oil and gas industry spent. Since 2008, Obama has been the #1 recipient of pharmaceutical industry donations, with the next 4 being Republicans: Orrin Hatch, Fred Lipton, Scott Brown, and Mitt Romney. Now, for me, that helped explain what seemed to me to be an otherwise ridiculous political miscalculation on Obama's part in an election year when he continued to crack down on the medical marijuana industry in Colorado and California. I thought, what's he, crazy? But it seems to me it could be in some way payback to Big Pharma, protecting them, as Michael Corral suggests, from competition as they get ready to bring a new generation of cannabinoid medications to market. Now, I'm not suggesting that marijuana is Big Pharma's most important lobbying effort. I think healthcare reform is much more important to them. But still, if you have the ear of policymakers, you use it to say whatever it is you need to say, including what you have to say about cannabinoid medicines. In other words, what might make medical marijuana so yesterday might not be the popular rush to full legalization, but even a bigger industry rush to pharmaceuticalization. Nonetheless, I want to conclude by saying I think it's premature to declare medical marijuana dead. First of all, Americans are increasingly suspicious of Big Pharma. For one thing, pharmaceutical drugs are getting more and more expensive. They've increased in price by about 15% every year since the late 1990s. This makes Big Pharma by far the most profitable industry in the US. 10 years ago already, the combined profits of the 10 drug companies in the Fortune 500 was higher than the profits of the other 490 combined. This also makes Big Pharma very unpopular. In my book, Dying to Get High, I reported on a series of Harris polls in which the public was asked to evaluate various large industries starting in the late 1990s. In 1997, 79% of Americans thought the pharmaceutical industry was doing a quote-unquote good job. Less than a decade later, that figure had dropped to 44%. The only industries that ranked lower were health insurance and managed care corporations and the tobacco industry. One result of this is that Americans are increasingly turning to complementary and alternative medicine. According to a 2004 federal report, more than a third of Americans reported using some form of complementary and alternative medicine, and herbal and botanical medicine was the most commonly used form. As Valerie Corral, the other co-founder of WHAM, pointed out, quote, "There's a culture that can't be killed by pharmaceuticalization. The medical marijuana culture is the same culture that already looks to alternative healing modalities. If the pharmaceutical industry is given a monopoly on cannabis, people will simply find alternative access. Illicit avenues will resurface," unquote. The other reason that medical marijuana may not be a thing of the past, or the medical marijuana movement as we know it, is that, as Valerie Corral points out, quote, "If it's over, how come so many people still don't have access to medicine?" Now, there's currently 18 states and DC with medical marijuana laws. That's it. And even in those states, many patients still can't access marijuana, either because they're unable to secure a physician's recommendation, or, at least as importantly, because they can't afford the cost of securing a medicine that's not covered by health insurance. One WHAM patient I interviewed recently, Sherry Paris, observed, quote, "Yes, medical marijuana is totally yesterday if it's a matter of being able to sashay over to a buyer's club and pay $60 or $90 for a bud. The whole issue is resolved if you're unwilling to look at the economics of the issue. But if you live in the real world, we haven't even begun to deal with this. If I'm a sick person whose finances are destroyed, and believe me, that's what happens to sick people in this country, I need a different model for medical marijuana, different than the dispensaries or even legalization, which I think would be based on a dispensary model. The medical marijuana industry, like the recreational industry, like any industry, thinks about their own wallet. They aren't interested in people who can't buy their product. And the point is, most people couldn't survive a terminal diagnosis economically, even if they managed to somehow survive it physically. The thing versus the medical thing is bringing up the underlying issue of the failure of the marijuana reform movement to look at issues of poverty and illness in any significant way. The issue of marijuana prohibition cannot be resolved without resolving the war against the poor, unquote. In short, my view is that the future of medical marijuana is tightly linked to the future of healthcare reform in this country, reform to make healthcare affordable and universal. And in particular, reform that ensures that complementary and alternative medicine is affordable and available to all. Thank you.